We got great stories.
We do. We have really good stories.
Welcome back to another episode of Beyond the Bedside. I'm Betty Long, President and founder of Guardian Nurses Healthcare Advocates, and to my left is
Rebecca Czarkowski.
Well, this is 2026, and this episode is, I'm kind of excited because I haven't told you what we're going to talk about. Every year there's a lot of think tanks talk about the best healthcare jobs. They look downfield and forecast what the best healthcare jobs are. And U.S. News and World Report, which often does the survey on best hospitals, has done a best healthcare jobs in 2026. Now, they base these rankings on the U.S. Bureau of Labor Statistics has several criteria: future prospects, wage potential, employment, job safety and stability, and work-life balance. Oh, don't chuckle, work-life balance.
No, all of it. Like I'm thinking, okay.
Okay.
In my head.
So would you like to take a guess at what the number one best healthcare job is according to U.S. News and World Report?
Sure.
Okay.
Radiologist.
No.
You know why, probably? Now that, because future, right?
Future job prospects.
Yeah. A little bit with AI.
Yeah, robots. I just heard there were robots doing women's ultrasounds. What could go wrong?
Well, it's a woman. Who cares?
Whatever.
How about a coder?
No.
Isn't it sad I'm not saying a nurse?
Because the reason I said that about the robots doing women's ultrasounds is that in Alabama, a lot of counties, there are no GYNs.
True. Okay, fair. Fair.
So
I take it back. I am.
But it's coming. Okay. So radiology, coder.
It can be anybody in healthcare, yes?
Yes, and I would tip it off, think clinical.
Podiatry.
Last chance. Podiatry. No. Why would you say podiatry? You think people's feet are top of the list?
Well, usually I know there's always circumstances, but you usually see a podiatrist in the outpatient setting. It's a little less.
No, actually, strangely, on this top 10 list, there are only 2 slots that are physicians. Okay, so that tells you another thing. That's why Alabama's probably having trouble.
Man.
Okay, the number one, you've had three
all
times.
right.
The number one, according again to the U.S. News, nurse practitioner.
Oh, that made me happy.
Okay.
Because it extends access for all of us, right?
Yes, correct.
It's a nurse, so they start as an RN. Everybody starts as an RN, so I love that. I like that. Okay. That's number one. I like it.
Number 2 is physician assistant.
Okay.
Another extender, right? They talk about physician extenders. Number 3 is a speech language pathologist.
Wow, how about that?
Mm-hmm. Respiratory therapist.
Yeah, that's hard work. That can be oof.
Nurse anesthetist. So 2 nurse roles. Occupational therapist, dental hygienist. That was strange to me.
Interesting. Bless their souls.
Psychiatrist, ophthalmic medical technician.
Psychiatrist?
Yes.
Wow.
Psychiatrist. I don't think there's enough.
There's not enough. Go ahead.
An oral and maxillofacial surgeon. So podiatry was not on the list, but oral and why that? Why oral and maxillofacial surgeons?
Can't talk. Right? Like, people can't be. They can be angry, but you won't know it because they're not.
Include surgery.
Right.
But on that list, what I think is striking to me is that nursing
is not.
Registered nurse is not on the list.
That makes me sad.
Yes,
it's not on the list anywhere.
There's going to be a job. There's going to be a huge shortage of bedside nurses because all the baby boomers are looking to retire or just leave the profession. So based on work-life balance, job stability, and safety, employment, wage potential, and future prospects. Registered nurse wasn't on the list. So that made me sad, even though there are 2 roles, nurse practitioner and
Nurse anesthetist.
nurse anesthetist, which are advanced nursing degrees. So why do you think?
Why do I think?
Yeah.
Coming out of the gate, safety is going to be the first thing that I think. That,
Okay.
you know, it is different now. It's not, a couple things. I think safety has its own set of problems, and then, you know, not being, all the schooling, all the education, all the clinical time, all the people out there that we interact with and work with and help and support, not considered a profession, right? So I do think that you're not, you know, it's not a vocation. Like the level of education, knowledge, and work that goes into becoming a nurse is every bit as significant as everybody else, but it's not respected the same way.
Yeah, but if I look at the criteria, they're not talking about respect. They're talking about future prospects, wage potential, employment, yes, job safety and stability. I'm not sure about safety, but stability for sure. And work-life balance, that hasn't been really brought up with nursing because there's 3 12-hour shifts. There's different shifts that
there's flexibility of what you can do in the career.
So that kind of, when I thought of the criteria, I thought, why isn't registered nurse on this list? So now there's another list.
Oh God, okay.
You know, because the top 10 healthcare support jobs for 2026. So now there's still no nurse because we're not, you know, we don't support. Medical and health services manager.
Medical and health, what is that?
Services manager. Well, an office manager.
Okay.
Yeah.
Okay.
Home health aide, for sure.
Wow, yeah.
For sure.
Yeah.
Okay. Massage therapist.
Well, now wait, we're on the East Coast. So when you get to the Pacific Northwest and the West Coast, that's part of like Eastern and Western medicine.
Okay.
And so it is considered part of the biz.
Physical therapist assistant, medical assistant,
bless them,
occupational therapy assistant, medical secretary, dental assistant, nursing aide, number 9, coming in at number 9, and physical therapist aide.
Wait, go back. What was 6 or 7? The patient.
It was physical therapy. It was medical and health services manager, home health aide, massage therapist, PT assistant, physical therapist, medical assistant.
So what's the difference between a medical assistant and then the last one, nurse aide?
Physical therapist aide?
Nurse aide.
Nursing aide?
Yeah.
Well, so in my head, nursing aide is more like long-term care, and medical assistant is like office manager, not office managers, but clinical offices where they're doing, right, maybe the blood pressure, maybe they're drawing blood. Right.
Okay.
A nursing aide wouldn't draw blood.
Right. Okay, that's good.
So again, it just strikes me like that when you look at the world of healthcare, these are not the ones that I would have thought.
And have you? I'm assuming you've looked at it in previous years, or that you can remember, or no?
That's a huge assumption.
Yeah, remember it. It's a problem. But I wonder when did we drop off?
I don't know. Feels like I don't know.
Why do you think?
It feels like to me nursing, the profession of nursing, needs a public relations firm. Right? Like, I just think we need...
I have somebody perfect.
And who's that?
A Betty Long. That could be like, you know.
No, like, I feel like
I know.
we're not... Like, we're the biggest workforce in the healthcare system. There's 4 million nurses in the United States. That's a lot.
Wow,
4
that's
million.
a lot.
And if you break it down into different facilities or hospitals, we're often the biggest workforce in the hospital. But yet there's not very good job prospects for 2026. Doesn't make any sense. So I feel like if anything, we should, if anybody's listening out there that has a public relations firm, I think you should tackle nursing.
Physicians too, I think both. There weren't a lot of physicians, and I would say to you that the medical field is taking a bad hit.
Right, well, the cost alone, right? There's very few philanthropists that are offering tuition-free, like at Mount Sinai up in New York, they had, so it's ridiculous amount of money, and if depending on the specialty, and if we need primary care, which is the number one, you're not making that much money.
Correct.
So paying the loans back,
it's like you have to say, how will I set up my home, my family, pay bills, pay mortgage, pay rent.
Right. So I think when you think about psychiatrists, they're in short supply, and they do not usually accept
take insurance.
So that's private pay, veterinarian, similar thing, but not on the list. And it was just interesting. Oral and maxillofacial surgeon, not cardiothoracic surgeon, not neurosurgeon, not some of the, when you think about the number one killer of people in the United States, it's heart disease. And yet, and we do a lot of surgeries and a lot of, maybe cardiologists are probably gutted with cardiologists.
Yeah, no pediatrics.
Nope.
No mommy and me, labor and delivery, like nothing.
Right. Now, wait, I mean, this is only one, but they looked at the U.S. News and World Report looked at the Bureau of Labor Statistics. So there's data, and I always say follow the data, but not this time.
Oh, we have to do some digging. We have to look further into this.
But again, the prospects of being a nurse, I think, are bright.
Keep going.
I mean, I know it's hard work.
Sell it to me. Tell me why.
Okay. Because you have, to your point, flexibility in scheduling. Right. I think that...
I would say in job, right? You can work a job that has a flexible schedule.
Yes. All right, let's go back to nursing school, because nursing schools are typically 4 years now. They're college programs, often BSNs. There are diploma programs and associate degree programs offered for 2 year, but mostly people, hospitals and employers want BSNs.
Yep.
So it's expensive.
Yes.
There's not enough teachers who are teaching
to get into programs, so there's waiting lists.
Right. So when you factor in that there's a shortage of nurses, there's a shortage of educational opportunities. So it makes, to me, like a brighter employment future.
Okay.
Right? Like, okay, there's not, if I'm one of the students that are selected to go to nursing school, I'm looking pretty good.
Yeah, okay, so I have over here that, right? Like opportunity, likely always have a job. You can move around so that you can kind of challenge yourself if you want to try new things. If you don't have to. There's bedside, there's outpatient, all kinds of things. Right. So here's our seesaw, right? Here that is.
Okay.
And then I'm going to say to you, okay, then on the other side, you were talking about school. 4-year school, expensive. And so, that's step one, right? A lot of times historically, nurses would do a diploma program, get their associates, get their RN, start working, and kind of offset that cost by having tuition reimbursement, right? That's how I got through all my higher education. So
those benefits are probably drying up
anyway. Yes. Correct. So now you're looking at, job security, but wow, this is going to be not just a lot of time to get out to the working force, but it's expensive.
Right.
Okay.
And I'm going to, like a physician, I'm going to have a lot of loan if you're not able to pay for college.
Correct.
You're going to have loans, and then you're going to have not great salaries, over 100,000, I would think, at least in the East Coast. West Coast,
once you've experienced,
But I just feel like not on the list, not on this. We're not a profession. We need a public relations firm.
So
we need someone what's the American Nurses Association doing? What's AONL doing? Like, where are the nursing organizations nationally? Where is the campaign to recruit students?
They're working on safety in the hospitals and safety in the ERs, and they're working on trying to get proper staffing, like to get to the recruitment, to get to the messaging and the public relations and all of that, you have to be able to sell them an honest bill of goods. You want to not sell them a bill of goods like it's disingenuous, but you also want to, is the job of a healthcare clinician, whether it's a physician, a nurse, a PA, an NP, whatever. And I'm going to say it's a profession, although
The Department of Education doesn't think it is.
Thanks.
Yeah, that's true.
But I will say that
It's
I
not sitting
think,
well with a lot of
they're striking and like they're working on current situations for us out in the field, right?
I still think that there needs to be a greater effort. But years ago, well, maybe Johnson & Johnson is still doing it. Johnson & Johnson did a great campaign.
I do remember that.
Right. So
Good
the
campaigns.
Johnson & Johnson campaign was memorable and may have resulted, I don't know what the statistics show, but may have resulted in more students coming into nursing. So I guess I challenge the nursing leadership in the country. What are you doing about recruiting if there is a shortage? And there will be.
I think there already is. Right. But to your point, the schools are the other piece, like staffing, having enough programs.
Well, that's another thing that bugs me. There's a couple things that bug me.
A couple things really
Occasionally. The fact that they require MSNs, which is a Master's of Science in Nursing, to be the only opportunity of the instructors. They don't typically allow MBAs.
Correct.
Right? Masters in Health Administration.
Public health.
Right. So they're limiting the pool of candidates to teach the students who may be. So if we grow the audience of people who want to go into nursing, there's not enough opportunities to teach them. So what I say is, who's minding the store? I want to say to the national organizations and the national leaders, what are we doing? Because I know there's a lot going on, for sure, nowadays. But
you have to look downfield because it's only going to get worse. It's only going to become harder. Like we always say, the shortages in the healthcare space, nursing, absolutely, but in any space, right? There's less people becoming physicians as well.
Right.
A same situation, like, I guess you would look at what is your output, what is your income, what's malpractice, and,
all the things.
all the things.
Right.
All the things.
But I do think it's a public relations campaign.
I think it's a public health crisis.
It will be. It will be. And I think that we're not looking to, and one of the things that I've often said to friends is that the legislators in Washington, D.C. have the gold card when it comes to healthcare. They have, they're people of influence, people of power. They get into the hospital whenever they want. They get an appointment whenever they want. They don't think that anything's wrong with the healthcare system, right?
Right.
So, it's the regular people that are having
That
the
are
issue.
having the issue,
right?
yeah.
And their inability or unwillingness to address the safety, the law that's we've talked about on previous episodes, it just means to me they don't really care.
We should put you behind a podium, right? I, Betty Long, Elizabeth Long.
Yeah, okay.
Right? If anybody could get it done.
No.
Nobody's going to get it done. Nobody's going to get that done in Washington.
Yeah, well.
We see how that
even
moves.
the nurses in Washington, because there are several nurses
Yes,
that
there
are elected officials, and I just feel like it must be so frustrating to push through the bureaucracy.
Mm-hmm.
And like when you think about healthcare and health, it is the number one.
That's all you got.
Right. Having been sick over the holidays,
That's all you got.
you
For
were
both
sick
of us.
too. Both of us were sick, and we understand
Ooh.
again how important it is to be
Yeah.
healthy and to have access to healthcare.
Correct, and have it move efficiently, right? And you need people and staff that are qualified and care.
Yeah, this is a big problem, and it's not an easy solution, right? There's a lot of components of it, but I just feel like we're missing the boat, and we need to toot our horn, right? We need to toot our horn and talk about how wonderful a career it is.
Yes. That's part, I'm saying that's what I mean. Like, all people know are what they hear. So if you have a family member that is a nurse or in the healthcare space and is burnout, you're not going to hear necessarily a whole bunch of positive there.
Well, it's like the news.
They're on strike.
Correct. If you go to social media for your news, it's all about people venting or complaining. It's not about, oh, I love my job and I just got off a shift and I helped a patient, family.
Yeah.
It's everybody venting. So I think, it's like my other idea about the good news station.
I love
right?
that.
Because it's cheap to do news, the fires, the murders, the this. It's not cheap to go out and talk about positive stuff.
Yeah, feel good stories.
So I think we need to, my 2026
We'll have to do some feel good podcasts.
We'll have to do some feel good podcasts. Yes.
Because I imagine this falls under the not so good.
There's a saying in PR, something about if it bleeds, it leads.
Oh, isn't that sad?
Yes. Right.
Wow, but it's true.
It's true. Just turn on the news.
Yeah.
Right.
And you get like a day, right? It's like day cycle, like boom, 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 boom.
We've tried that even with guardian nurses to when we're working with our PR firm we don't have bad stories, we have good stories.
Right.
And it's hard to get the good stories
out.
Attention of
To
the
pick up
of the
traction,
media.
right?
Right, because they're going with
And there are so many good stories.
Yeah.
It's amazing, right? For the space that we're in, like when every day there's a positive.
And I would say that every day there's a positive in the hospital. Some nurse has done something really heroic, and there's no mention of it.
Yes,
right?
ever.
Right. There's a woman who does, Sandy Summers does a blog post, and she has a website, and she monitors the media and the images of nursing, right?
Oh.
And I read it, and I think, that's not. And I was just watching a show on TV, regular TV, The Rainmaker, and the main premise of the story is this male nurse who is murdering patients in the hospital by overdosing them on morphine.
My mom would say, bad nursing, bad nursing.
And I was like, oh, okay, I'm going to watch this show. I can't watch this show. And one of the things he would say is, it's okay, I'm a nurse.
Ew, to get them to buy in and feel safe. And
right, and I thought,
that's horrible.
Just what we need. A psychopathic nurse. Great.
I don't like that.
Yay. But then you have the image of the pit, right? And the charge nurse Dana, who's a rock star, keeping things.
Yes.
And
have you started season 2?
No, I haven't.
It's good.
But I think people get their information from media, from stories, and we're not getting enough positive stories. So that's all I want to say.
Well, that would be something that we're going to do. We will be back. And we are going to do a positive story.
Okay.
Okay?
Got it.
That's our goal.
All right.
We have to lead
by example.
Lead by example.
Absolutely. We got great stories.
We do. We have really good
stories. Okay. Thank you for watching. And we'll catch you next time on another episode.
And you can comment Betty for state rep.
Yeah. Okay. I have a couple other jobs. All right.
Bye.
Take care. Bye.